Sustainability planning is really essential in the work as it relates to cancer screening, cancer prevention, all levels of cancer control. I really do think that sustainability for our programs, particularly those of us in research, those of in academic settings, and even community-based organizations, we have to really think about how we're going to continue to support much of our work that really often starts with foundation funding, grant funding, but we have to think about the long-term measure. Particularly for cancer screening and the work for the Colorado Cancer Screening Program, when we think about sustainability, we've often thought about really the money aspect, the resource management. And so while that's very important as we think about the reimbursement strategies through insurance, through public payers, private payers, as well as really thinking about the medical opportunities for payment and reimbursement, that's not the only elements that really are imperative for making sure that we sustain. I think there's plenty of examples where we have seen payment, we've seen reimbursement that are here today, gone tomorrow. If we don't show the effectiveness of the work that we're doing through clinical champions, outreach, engagement, workforce development, as well as the larger community really engaging in our work, those dollars can be something that we have, but that we lose very quickly if we're also, in the general, also not showing outcomes and effectiveness. Through the work and my work for the last 15, 20 years, I've really had an eye towards what do we talk about for sustainability. And I think that part of the planning has to happen even at the beginning, in the middle, and at the end, because really to sustain this work and to make sure that we really provide the resources, the community that were intended, we have to really think about how we're going to not just implement, deploy, but long-term, how we're going to provide resources for our community. I think specifically for the medically underserved communities, there are opportunities, of course, for looking at strategies to help maintain the work, but oftentimes individuals who don't have insurance, who don't oftentimes have money out of pocket to pay for exams that can seem that they're actually on times just not necessarily necessary at a certain time and place, sustainability will have to always be an imperative as we continue to think about the medically underserved populations. When we talk about sustainability frameworks, there's oftentimes that community-based organizations, clinic systems can work internally. Those really include showing the value of a specific intervention, in our case, cancer prevention. That might be around workflow integration, it might be around communication about the value, it might really even be showing the leadership as well as people within all of the group about multidisciplinary opportunities for people to really engage. And sometimes at that organizational or system level, that's where there's really a locus of control, and it's really imperative that this is really brought into the team to really think about how do we sustain workflow integration, communication, showing outcomes and effectiveness. But part of the thing in terms of the Colorado Cancer Screening Program and much of the work at the university is also how do we support networks as well as really advocate for areas that need larger elements and really those critical ingredients to achieve sustainability. One of those examples is for funding stability. Funding and really thinking about how do we make the case for reimbursement as well as funding beyond grant and foundational dollars or even institutional dollars often takes the collective. We're really excited that we've been able to, on behalf of our Safety Net Clinic system, which is including right now over about 20 clinic system sites, is to utilize information from the collective to show the value of the work that we're doing, to be able to advocate for funding from our state government, from our policy officials, as well as really showing the data evaluation and the impact of our work at the federal level to be able to achieve even, for example, patient navigation, reimbursement for Medicare, Medicaid. And I think this is really an example of where we see using a network like CCSP to advocate for area where sometimes clinics and systems or CBOs can't independently do this work. I really think that part of the work that we're doing right now at the University of Colorado builds off the foundation of many others who've actually implemented and deployed awesome opportunities for putting together evidence-based strategies for really looking at sustainability frameworks. Part of these teams include Washington University, our colleagues at the CDC, NCI, and NIH. But I think that what we've been able to do in the public health sphere is really adapt the current models and really think about how do we look at that intersect between clinical, community organization, and even really thinking about sustainability of patient navigation, and really adapt this work and to build upon. And as a result, we've actually been able to integrate many of our sustainability framework and strategies to the national level, where American Cancer Society, National Navigation Roundtable, as well as AONN and their teams have really adopted these sort of models. I think sustainability is oftentimes seen as a big compound word, but how you do the work is really difficult. So being able to have a framework that we've been able to adapt, show success in our domain, and really think about how it can be applied to settings beyond Colorado, beyond just local, state, but now even at the national level have been a great contribution, and I'm really proud of the work that we've been able to achieve through the University of Colorado Cancer Center School of Public Health, building off of much of the work with many of our partners all throughout the country.